A measles outbreak is continuing in Texas and New Mexico, and as cases continue to rise, vaccine rates nationwide are falling.
According to the CDC, vaccine rates for diseases like the measles fell more than 30 states last year.
National correspondent Leah Waldman is joining us live now from New York. Leah, what's the status of these measles outbreaks, and why are the vaccination rates falling so much?
Isley Killing, good to be with you. In West Texas, we know that cases are continuing to rise. Today, the Department of Health there said that the number is now standing at 223 cases of measles confirmed. In New Mexico, just right by, there are now 33 confirmed cases. We're learning there's also 2 confirmed cases in Oklahoma tied to the outbreaks happening in Texas and in New Mexico. Now, when talking to vaccine education experts, skepticism is on the rise following the COVID-19 vaccines, because they were mandated in so many places. Those experts believe there's pushback against all vaccines now and against the scientific medical community.
Now, Lee, when was the last time we had a measles outbreak like this, and how was that treated?
That's a great question. To see the last time we had a measles outbreak, we have to look back about 6 years. It started at the end of 2018 into 2019, right here in New York, actually. Now, that targeted the Orthodox Jewish community, who had been targeted with anti-vaccine disinformation for years. Health experts here got that under control by going on the ground and educating people about the safety of the MMR vaccine. Now, it's also important to note there are no antiviral medications specifically to treat the measles once someone is in fact infected.
How are the measles spread, and what are the symptoms that we could look out for?
Well, the measles are extremely contagious, even more contagious than COVID-19. And we know that back 5 years ago, the World Health Organization declared COVID-19 a pandemic 5 years ago today. Now, you had to have face-to-face contact to spread COVID. That's not the case with the measles. An infected person simply needs to be in your airspace, and the virus lives for 2 hours in the air there. Now, healthcare professionals need to look out for cough, runny nose, runny eyes, but also a rash that begins on your face and then spreads down your body.
Thank you for your time today.
Thank you.
Well, it's not an Arkansas spring without severe weather, and it's expected later this week.
That's right. Let's send it over to meteorologist James Bryant with the latest.